About 60 to 70% of your body consists of water, and every part of it relies on water to function correctly. Dehydration can happen when you are not taking enough liquid or losing an excess amount of body water. This water loss can make your kidneys work really hard to filter waste into your urine. Water helps keep your blood vessels open so that nutrients can travel freely to your kidneys through blood. If you become dehydrated, a lot of wastes and acids in the body build up and can clog the kidneys, causing permanent kidney damage. However, all you need to do is find out how to keep your body water in balance and what are the best drinks that can keep your kidneys healthy and fast. So, today, let's learn about some of the top natural drinks that can improve your kidney health. Number 1. Red grape juice. According to studies, around 50% of patients suffer from acute renal failure because of the poor blood supply to the kidneys, or what you can call ischemia. Grapes, especially the red ones, are high in antioxidants that can reduce the risk of damage caused by ischemia. Resveratrol, an important antioxidant in grapes, has been shown a protective effect in rat kidneys with tissue damage caused by ischemia. Not only that, the antioxidant compounds present in grape skin and seed can also reverse kidney damage, which is caused by a high-fat diet. But that's not all. Red grape juice also has amazing benefits for the heart, as heart health is crucial for people with kidney disease. It helps keep blood pressure normal, one of the major risk factors for kidneys, and decreases bad cholesterol in people undergoing hemodialysis, lowering the risk of heart attack and other cardiovascular problems. However, due to its content of sugar and calories, some of you may wonder if grape juice is as healthy as fresh fruit, or if it is safe to drink. The answer is that adding moderate amounts of fresh grape juice without added sugar can be healthy, even for diabetics. According to the National Kidney Foundation, adding a glass of grape juice, or at least 15 grapes a day, can be safely consumed by most people with kidney disease. So, to improve your kidney health, opt for red grapes juice several times a week. Number 2. Coffee. More than 6 in 10 people in the U.S. drink coffee every day, and they drink an average of 3 cups of coffee per day. However, usually when people find out they have kidney disease, one of the first things they might wonder about is if they have to stop drinking coffee. The answer is no. Coffee is not bad for your kidneys, even if you have kidney disease. Coffee not only contains caffeine that increases alertness and decreases fatigue, but also contains antioxidants. Most studies show that these antioxidants in coffee are responsible for protective effects on the kidneys. Drinking coffee can also help with better kidney function, lower the risk of developing chronic kidney disease and kidney stones, and even lower the chance of death due to chronic kidney disease. But here are the things that you need to consider. One small 8-ounce cup of black coffee contains 116 milligrams of potassium, which generally makes it a low-potassium drink. However, if you drink 3 to 4 cups daily, it could increase your potassium levels, which could not be good for your kidneys. This is because kidneys will have to work harder to remove filter excess of potassium, which over time can stress them. Plus, if you add creamers or milk, it will further increase coffee's potassium content. Moreover, if you have high blood pressure, taking too much caffeine is not a good idea. However, you can drink less than 3 cups of coffee per day safely without any major side effects. But if your potassium levels or blood pressure are already high, make sure to take regular checkups and adjust your coffee intake accordingly. Number 3. Cranberry juice. Cranberry juice can be effective in lowering cholesterol and blood pressure, and its high levels of vitamin C offer various health benefits. But the important question is, can cranberry juice prevent kidney damage? First of all, healthy levels of cholesterol and blood pressure alone can directly affect kidney health, as the kidney works better with improved blood flow. Secondly, cranberry juice can also help prevent or treat urinary tract infections, mainly caused by E. coli bacteria. Some animal studies have found that the pro-anthocyanidins found in cranberry juice may stop the bacteria from gathering and sticking to the walls of the bladder and urinary tract. Cranberry juice as a beverage is generally considered safe to drink with no serious side effects, even for pregnant women. However, cranberry has relatively high levels of oxalate and may increase the risk of kidney stones in people who are prone to calcium oxalate stones. Moreover, most cranberry juice has added sugar and high potassium levels. The potassium levels can vary from 50 milligrams to over 200 milligrams per 8 ounces or 1 cup serving. So, while buying cranberry juice, make sure to choose the one with lower amounts of potassium. Number 4. Green tea. Green tea contains important antioxidants that help prevent kidney inflammation, tissue damage, loss of kidney function, and even stone formation. Primarily, green tea extracts might help prevent the formation of calcium oxalate stones. Studies have also shown that green tea extracts make calcium oxalate flatter, causing the formation of flat stones, which break down later and gradually pass out through urine. Green tea can also help to improve kidney function by managing blood urea nitrogen, uric acid, creatinine levels, and glucose excretion. Drinking 1 to 3 cups of green tea per day is considered safe for most people. However, green tea can be possibly unsafe if it is consumed in a high quantity that is 7 to 8 cups a day. This is because only 1 cup contains around 30 to 50 milligrams of caffeine, which is not good for you if your kidneys are already weak. Moreover, high amounts of catechins can cause liver damage. You can also drink decaffeinated green tea, which will provide you with almost all the same benefits except the added caffeine. Number 5. Acai berry smoothie. Acai berries are grape-like fruits that grow in clusters and have a very short shelf life. They are usually available as powders, frozen fruit puree, or pressed juice. Acai berries are rich in antioxidants, specifically anthocyanins and polyphenols. These anthocyanins have been shown to protect against cell damage and improve brain and kidney health. According to the National Kidney Foundation, these berries are a great food addition for chronic kidney disease, or CKD, as well as for people on dialysis. In fact, an animal study showed that acai berry extract can have the potential to decrease serum urea, creatinine, and blood urea nitrogen. Not only that, in 2021, acai seed extract was found to lower blood pressure and had the same effect as blood pressure-lowering medications. But here's the thing. Acai smoothies are usually made with fresh fruits and vegetables, so you may need to be cautious about the potassium content of those foods. 1 pack of frozen unsweetened acai berries contains around 121 milligrams of potassium. So, consult your kidney dietitian to manage your portion size depending on the diet as a whole and potassium levels in the blood. Number 6. Pineapple juice. Pineapple juice is another great choice for people with kidney disease because of its low potassium content. Aside from this, pineapple also provides vitamin A, fiber, and bromelain, an enzyme that can reduce inflammation. The chronic problem of the kidney starts when it becomes unable to filter the major waste products and fluids from the body. When this happens, you have to lower your potassium intake as well as sodium and magnesium, because these minerals can further strain kidneys, degrade their function, and lead to kidney failure. Pineapple in these circumstances is a good choice, especially because of bromelain. This protein is actually a degenerative enzyme that cuts proteins into smaller pieces, and as a result, it can pass easily from the kidneys, easing the load on them. Moreover, bromelain, being an anti-inflammatory agent, also reduces pain and prevents kidneys from bacteria and other microorganisms. But how much pineapple juice can help you reap these benefits? According to USDA, 100 grams or almost half a cup of pineapples provides around 130 milligrams of potassium and only 8 milligrams of phosphorus, which makes it a good portion size to start with. However, you still need to consult your kidney dietitian if your potassium levels are already high. Number 7. Ginger tea. Ginger's anti-inflammatory and antioxidant properties can help in protecting the kidneys and lower high creatinine levels in the blood. Creatinine is a waste product that is naturally produced in the body due to the breakdown of creatine during intense exercise and also by consuming protein-rich foods. This creatinine is usually excreted out by kidneys, but sometimes this creatinine gets built up in your body, causing damage to your kidneys. The 2 main bioactive compounds, gingerols and shogaols, have been shown to protect kidneys in various different ways. So, consuming ginger tea might not only help with managing creatinine levels, but will also help people suffering from kidney stones, Some studies have shown that ginger tea might be effective in dissolving the buildup of stones in the kidneys. Moreover, ginger tea can also help in lowering blood pressure and blood sugars, which are the common risk factors of chronic kidney disease. However, drinking ginger tea or taking its supplements might be risky if you're taking medications for lowering blood pressure. Other than that, eating ginger in large amounts might result in mild side effects like mouth irritation, heartburn, gas, or other digestive issues. Most studies recommend a safe daily dose of 1,000 milligrams of fresh ginger, which is the equivalent of 1 teaspoon or 5 milliliters of freshly grated ginger extract, 0.4 teaspoons of liquid ginger extract, or 4 cups of pre-packaged ginger tea. Number 8. Blueberry juice. If you want to increase your daily intake of kidney-friendly antioxidants and anthocyanins, blueberries can be a great addition to your diet. Blueberry juice is a rich source of fiber, vitamin C, vitamin K, and antioxidants. Also, it is low in calories and high in fiber. Almost a half cup of blueberries has 40 calories with about 2 grams of fiber. Amazing, right? Moreover, if you have a kidney problem, 4 ounces or 1 cup serving of blueberry juice has less than 150 milligrams of potassium, making them a low-potassium fruit choice. Fresh blueberry juice, without sweeteners and additives, is also low in sodium and phosphorus, making it suitable for a kidney-friendly diet. The National Kidney Foundation has also declared the recommended amount of blueberry juice to be safe for all kidney conditions, including transplants, hemodialysis, and kidney stones. Number 9. Carbonated water. Some of you may wonder if carbonated water is bad for the kidneys because it might be linked to kidney stones according to some studies. So what's the reality? Kidney stones are actually hard deposits made of minerals and salts, and carbonated water is made with certain salts that can increase your daily sodium intake. However, drinking 1 glass of sparkling water is unlikely to raise sodium levels too high. Also, the salt content of these drinks usually depends on the type of carbonated water. Some of these include club soda, seltzer water, sparkling water, and tonic water. Among these, seltzer water is the one that generally doesn't contain added minerals, which gives it a plainer taste. Other than that, carbonated water is a great source to keep yourself hydrated, and hydration actually lowers your risk of kidney stones. One last thing, fizzy waters may also contain calcium. Calcium from food and drinks can bind with oxalate in the intestine and reduce the risk of kidney stones. Without calcium, oxalate passes into the urine and causes the formation of kidney stones. But if you have any gastrointestinal condition like GERD or IBS, you may do better with a low consumption of carbonated water to prevent excess bloating, gas, or reflux. Number 10. Hibiscus tea. Hibiscus not only supports a healthy heart, but also protects other important organs of the body like kidneys. In fact, some studies found that the antioxidants in hibiscus tea might help restore and support damaged kidneys. Speaking of kidneys, hibiscus tea might be a good choice for your entire urinary tract. When harmful organisms try to make the urinary tract their home and cause infections, they cause burning, itching, and painful symptoms. Interestingly, certain compounds in hibiscus create an environment in the urinary tract that is not so favorable for these harmful bacteria. Not only that, hibiscus might also help protect against fungal infections that are sometimes difficult to treat. Other than that, hibiscus tea can also lower blood pressure and cholesterol levels, reducing your risk of heart disease as well as kidney disease. You can safely consume 2 to 4 cups of hibiscus tea every day. However, keep in mind that certain medications might interact with hibiscus tea. These include malaria drug chloroquine, medications for high blood pressure or diabetes, and birth control medications. Moreover, pregnant and breastfeeding women should avoid hibiscus tea as it can cause complications. Now, let's begin with some frequently asked questions about the drinks for kidney health that you might already be looking for. Number 1. What not to drink if you have kidney problems? Drinks like cola beverages, alcohol, and sugary drinks can directly harm your kidneys. Studies suggest that drinking 2 or more cola drinks a day can increase the levels of phosphoric acid that can strip calcium from bones and might lead to kidney stones. Moreover, alcohol and sugary drinks can increase blood pressure and sugar levels leading to kidney damage. So, avoid these drinks. Number 2. Is milk good for kidney patients? It may be important to limit your milk intake as well as other dairy products to avoid the buildup of protein waste, potassium, and phosphorus. Milk is one of the most common high-potassium drinks in our diets, as 1 cup of reduced fat milk contains 366 milligrams of potassium. Consider alternatives like unenriched rice milk and almond milk, as they are much lower in potassium, phosphorus, and protein than cow's milk. If you want to know more about how you can improve your overall kidney health, make sure to watch these videos too.